exercises that's given a lot to help knees, hips, backs, feet. There's just a couple do's and don'ts with them. So when you go to do your heel raises, you want to think and make sure that your knees are not locked. And what I mean by that is if you let them go, they're going to slam backwards. You just kind of want to give a little bit of a bend, but you're not trying to do them in a squat. The other thing that you want to do is you want to make sure that your knee is lined up with your second toe. So what your thighs do affects your feet. So as I roll my thighs in and out, you can see how that affects the feet. So you don't want to be in this collapsed position. You want to get the thigh rotation so that your middle of your thigh is lined up towards the second toe so that you've got good arch support as you go. So we're gonna come here, and then you just wanna make sure that all of this stays even. So you don't wanna roll out to the side or collapse in. Everything just stays level, and then we lower down. So we're lifting up nice and slow, and then lower down. And you don't have to go all the way up unless you wanna be a ballerina or things like that. So just nice and slow. If you haven't done these a lot, then just start doing it on 2 legs. So we're on 2 legs and lowering down, and then you can build up to doing 1 leg where you're lifting up and lowering down as well. The other thing you want to be careful of is that you don't shift forwards and backwards. So as you're going up, you shouldn't get this front to back motion. So that just comes from a little bit of hold in the belly, and so that we're lifting mostly straight up and mostly straight down. If you feel that rock, then you've probably let the belly go. So it just helps to get your core a little bit, but it also burn the calves a lot more if you're not doing that shift back and forth, because that doesn't really do anything for the calves, which sort of defeats the purpose. The other thing that you'll see a lot online is they talk about going onto a step and dropping your heels off the step and doing heel raises there. There's a big difference between exercising for muscle bulk and exercising for joint health. That's a really difficult thing to do and very often sets off plantar fasciitis, knee pain, ankle pain, because it just overstretches everything. So it wouldn't be something I would suggest as a physical therapist unless you're going to be a bodybuilder and you really need to bulk up your calves. So those are some sort of easy do's and don'ts for heel raises, and hope that helps you out.